So this week we're thinking about educational pathways in pharmacy, and we've already talked a little bit about how that has evolved over time in the United States, and we talked about the pharmaceutical disciplines. In this module I want to think about specifically about professional education in pharmacy, and we learned already that training has evolved from a purely experiential model in the early 19th century to a doctor of pharmacy and much more intense academic as well as experiential program at the beginning of the 21st. So we've had substantial change in our educational model over time. But what does it specifically mean to be in one of those programs? And by the way, during this week's interview videos, you're going to have an opportunity to meet students in all the various kinds of programs we're talking about this week. So we will have a PharmD student, and we will have a graduate student, and we will have a resident and a fellow in front of you. I really encourage you to watch those and to learn from the students that are in these programs as well. The other thing that I'm particularly interested in you learning in this course is the distinction that we will make between graduate professional education and graduate research education. I really want you to come away from this understanding fundamentally what a PharmD program is and fundamentally what a PhD program is and how they differ. And here we know that graduate professional education, things like PharmD, MD, DDS, and the like, these are fundamentally preparation to become a practitioner. So when I'm in a PharmD program, yes, I may do some research along the way and some other kinds of activities, but I am fundamentally preparing myself to practice pharmacy. And if I enter something like a PhD program, or a graduate research education program, I am fundamentally preparing myself for research. So that's something that I really want you to go away with. I've said to students here that I've been on the admissions committee at Ohio State many years for the PharmD program, and quite often students come into PharmD interviews here and it's not clear to me that they understand that distinction between PharmD and PhD. I want you to walk away from this course understanding it. Well, as we think about the professional education in pharmacy or the Doctor of Pharmacy or PharmD program, I want to think about a couple of associations that could be very helpful to your understanding of these issues and for more information as well. The first of these is the Accreditation Council for Pharmacy Education, or ACPE. We've mentioned this organization a couple of times to you already in the course, and I've given you the website here where the public can access all the information that they have. They fundamentally accredit professional programs in pharmacy, the PharmD, and they also accredit continuing education programs, and you see that's a pharmacy fundamental for today. So we have periodic visits from ACPE where they come to the college, they study our curriculum, we prepare a very intense self-study of everything we're doing that we give to them ahead of time. They meet with pharmacy faculty, they meet with students, they meet with practitioners, sites, and administrators in the university to see if we are meeting the standards that are set up for these programs. And if so, we will be accredited and our students can sit for licensure. It's pretty important. And I mentioned this to you earlier in an earlier video as well, but there are standards that we all must meet, but all the programs differ in some ways, and we have different entry requirements and a little bit different focus of the curriculum while meeting the essential standards of ACPE as well. The next association that I want you to be aware of that can be helpful to you is the American Association of Colleges of Pharmacy, or AACP, and I mentioned this in earlier videos to you as well. Here you have their website, aacp.org, and I would suggest that you look at this site as you work your way through this course. There's some really good information there. You'll see they have a student center that you can go to. And in that student center, they have a pharmacy school locator where you can locate all the pharmacy schools in the country and go to their websites and learn about their programs and their requirements. By the way, in that student center, they also have a cool tool where you can compare aspects of the programs across different parameters. So if I'm looking at schools that have certain things and I want to weed them out, they have a tool that will help you do that. And I told you there are 129 schools in the country, so it's no small task to figure out which one best fits your needs. And then finally, they have information about the Pharmacy College Admissions Test, or the PCAT. This is a standardized test that about 2/3 of the pharmacy schools in the country require. They don't all require it, but it tests the fundamental knowledge, the basic knowledge that you take and learn in prerequisite courses to see how you compare with other students who are applying. And as you probably understand, application to these programs is competitive. So many students apply, and then usually a fraction of those who apply are admitted. And that admissions process might include an interview, certainly an application, maybe an essay, and information about your resume and all that kind of thing. Another group that's important is called the Pharmacy College Application Service, or PharmCAS. I have their website here for you, pharmcas.org. And this is the majority of students, not all of them, but the majority, or the majority of programs, not all of them, use PharmCAS in their application process to kind of centralize and mechanize things. And on the PharmCAS website, you can find school information and school pages for those schools who participate in this process with them. It can be another good source of information for you. Well, so let's think about the PharmD curricula, and I want to come back to some of these associations as we do that as well. So here we have AACP, American Association of Colleges of Pharmacy, their listing of goals for PharmD curricula. So let's just kind of run through those. They want you to be able to provide pharmaceutical care to patients. So remember, pharmaceutical care was a concept introduced in the 20th century by Doug Hepler and Linda Strand, where it emphasized that it needed to be patient-centered, it needed to focus on patient outcomes, and pharmacists need to accept responsibility in that process to monitor these outcomes. So the first goal, according to AACP, is for us to teach you to provide pharmaceutical care to patients. And remember, in today's vernacular, we probably would think of that as medication therapy management. The second goal is to help you develop and manage medication distribution and control systems. We need to be able to work in drug distribution and to manage it appropriately. And I said we need to get the right drug to the right patient at the right time. And that's absolutely for sure, and you'll need to learn that in your educational process. They want us to be teaching you to manage the pharmacy. And how can you manage the people? How can you manage the practice? How can you manage the vast resources that'll be at your command as you enter these fields? We want you to be able to promote public health. And I contend, and I'll probably say this to you again, that the important issues in pharmacy that are really strong and driving issues right now are really public health issues. So how can we promote public health through what we were doing in our practices of pharmacy? How can we provide drug information and educate our patients properly? And then they provide goals within all the major areas of study. And we laid those out to you when we talked about the pharmaceutical disciplines. We're going to be providing you education in pharmacology and pharmaceutics and medicinal chemistry and pharmacognosy and pharmacy practice, and also in pharmacy administration. And these really, if you think about it, they deal with the biological, the chemical, the physiological, the clinical, and the administrative sciences within these pharmaceutical disciplines so that you can take those practices and treat a patient. Here we have, their description of the major areas of study. I've just outlined them again for you. We studied the pharmaceutical disciplines in an earlier video. I think you get it. And then finally, let's think about some clinical objectives. So, we've talked about, the kinds of things we want to teach you, and we've talked about what the disciplines are in terms of how we're going to accredit these programs and all these kinds of things. But what are the objectives that AACP says we should be thinking about as we train you? First is to develop communication skills for effective interaction with patients and other health professionals. So communication is critical in any health profession, certainly is in pharmacy. I encourage you, if you are a prospective pharmacy student or any kind of health professional student, to do what you can to further develop your communication skills. What can you do right now to make you a better communicator? That we should also be teaching you to help students develop patient awareness in pharmacy practice. What do you know about patients? What do you know about their cultural differences? What do you know about their differences in terms of age and gender and all the things that might affect how you approach a patient around a specific medication therapy topic? We want you to enable students to integrate knowledge acquired in the classroom toward the resolution of real problems in the practice setting. So we're teaching you all kinds of stuff. Can you take that information and solve a specific patient's problem? And that'll happen through the experiential training you get, but it'll also happen through your your practice in terms of internships and things you do beyond the classroom as well. We want to develop students' awareness of their responsibility for monitoring medication regimen. Regimen meaning a course of therapy. If I have a medication regimen, it means I have a certain course of therapy I will take to treat this symptom or this disease that I have. So we want you to be able to monitor these regimens, very important in 21st century pharmacy practice. And then we want students to become more aware of the general methods of diagnosis and medication therapies, the diagnoses and the treatments that we use in contemporary healthcare. So what are our pharmacy fundamentals for today? It is continuing education was the first one. Educational requirements to maintain certification or licensure. Pharmacists are required to report a specific number of continuing education units or CEUs per year. And these vary between states, usually around 20 hours per year or something like that to maintain my license on an ongoing basis. Oh, and that's the only one for today. So now let me leave you with our discussion forum question. I'd like you to be able to describe the fundamental differences between graduate professional and graduate research education, as I said. So let's talk about in our discussion forums, what are the fundamental differences between these, and what career trajectories would you attribute to these types of programs? If I'm in a PharmD program or I'm in a PhD program, what kind of career might I be preparing myself to enter? Well, I hope this has been helpful, and I look forward to seeing you again soon.